Hi, I'm Claire Jenkins, a veterinarian and the founder of Vet Chat, which is telehealth for pets. We started back in 2017 with just me answering pet carers' questions at night until midnight. Since then, I now have the privilege of working alongside a team of more than 40 dedicated vets across the country. We're available 24/7. We've supported pet carers with over 150,000 consultations and have a 95% satisfaction rating. Vet Chat has become a trusted first line of support for Aussie pet carers. And the why is simple: to make vet care more accessible to every pet carer while also supporting the long-term sustainability of the veterinary profession. And we're not just delivering care, we're actively advocating for change to improve access to care in Australia. We've presented to the South Australian Inquiry into Veterinary Mental Health and the New South Wales Inquiry into veterinary workforce shortages, making sure the voices of vets and pet carers are heard. So where does Vet Chat fit into the Australia's veterinary system? Firstly, telehealth will never replace in-clinic care, and nor should it. But it is a vital tool to support vets, clinics, and pet carers right across the country. We partner with vet clinics, rescue organisations, non-for-profits, as well as retail and insurance providers. With Vet Chat, carers can connect to an Australian registered vet by video, text or voice within minutes, 24/7. What we really provide is guidance in the moment, helping carers know what to do, when to do it, and with what urgency. Can this be managed at home? Can this wait until normal clinic hours, or is it an emergency right now? That guidance saves carers unnecessary costs and protects vets from being called in when they don't need to be. And the data is clear. Around 70% of after-hours concerns aren't true emergencies. Carers can get instant reassurance and vets get the rest that they need. So they're ready to help when it matters most. As we know, one of the areas where these access to care challenges are felt most keenly is in the shelter and the rescue sector. Our shelter partners and colleagues are dealing with a perfect storm of pressures. The severe vet shortage means recruitment is an ongoing battle, particularly in regional areas and other high demand locations. At the same time, service demand is higher than ever, yet shelters operate on extremely tight budgets. They simply can't compete with private practice when it comes to attracting and retaining staff. Transporting animals needing vet care into clinics is often unsustainable, both financially and logistically, and those access gaps become even wider after hours or in regional communities. This means treatment is often delayed with real impacts on animal welfare. And of course, it's not just the animals who suffer. Staff and volunteers are stretched beyond their limits, leading to burnout and high turnover, which only deepens the crisis. In many ways, shelters sit at the bottom of the trickle-down effect of the veterinary capacity shortage. Where there aren't enough vets to go around, shelters and rescues are where the shortage is felt most and where the impact hits hardest. Telehealth is bridging critical gaps in the shelter and rescue sector, making sure carers can access professional advice when in-person vets aren't available. That access provides reassurance and enables early intervention, preventing small issues from becoming emergencies. It spares animals unnecessary suffering, and it eases pressure on vets. It means problems are caught earlier, outcomes improve, and it all happens in a cost-effective, scalable way. We've already seen this in action through our partnerships with shelters, rescues, and non-for-profits like the Guide Dogs. And of course, things always feel more stressful at 2 a.m, which is why having instant access to a vet for reassurance can make all the difference. But there are gaps we can't fill, and that comes to regulation. Unlike human medicine, where you can access telehealth yourself, your family, your children, You can't do the same for your pets. That's because under current state guidelines, the veterinary client-patient relationship, or VCPR, or differs in some states, the naming, it is needed to diagnose and prescribe treatment, and it still requires a physical examination. If we look overseas, the picture is very different. In places like the UK, the US, and Canada, and in Canada, an online VCPR has been legal for almost a decade. In Ontario alone, data from hundreds of thousands of online consultations shows no complaints related to care or safety. It's proven, it's regulated, and it works. Here in Australia, however, these restrictions mean that we cannot diagnose or prescribe remotely. For shelter animals, that translates into treatment delays, expensive, often unnecessary transport, fewer resources left to help more animals, or no treatment at all. And yes, there are some narrow exceptions, like emergency prescribing, which also differs state to state, but they are very vaguely defined and fall well short of what shelters and people actually need. Put simply, under the current system, no in-clinic vet means no care, even when a vet could safely help online. To show you what this looks like in practice, let me share two case studies. First, the Lost Dogs Home. We were engaged to provide after-hours triage support for the foster carers, and the impact was immediate. Many cases could now be managed at home or wait for their clinic to open, keeping cases in-house, with only genuine emergencies escalated to the emergency centre if their on-site clinic was closed. This resulted in cost savings, which can now be redirected to helping more animals and far less strain on already stretched staff. The other is Sydney Dogs and Cats Home, which is seeing more animals than ever, with vets only on site a few days a week and just one vet covering the after hours. Current regulations mean telehealth can't provide the full support that they need, leaving one vet on call 24/7 for the past 4 years. In her words, sadly, at the end of the day, it's the animals that are going without. I don't think we highlight enough as an industry how telehealth could support the mental health of our veterinary teams. And powerfully, I've been on call 24/7 for 4 years. I don't have another option for these animals that come into our care because vets don't want to be on call 24/7, and I understand that. But if our hands are tied in terms of the support we can access, what's the answer for animals? So where do we go from here? There is a real opportunity for change. With thoughtful reform, we could allow a virtual VCPR under clearly defined safe conditions. And the benefits are clear. Better outcomes for shelter animals and all animals, a stronger, more sustainable workforce, improved cost efficiency so more pets can be helped, and alignment with human healthcare, where telehealth isn't just proven and trusted, it is expected. We are advocating for regulatory reform because Australia needs a system that protects animal welfare, supports our workforce, and embraces modern solutions to expand access. That means creating a modern framework that does two things. First, it must protect animal welfare and safety with clear, carefully designed guardrails. And second, it must embrace digital innovation to improve efficiencies and ensure care is accessible when and where it's needed. But we can't do this alone, and real change will only happen if the industry comes together, if we stand side by side as clinics, shelters, rescues, non-for-profits, and vets. We do need your support by adding your voice through letters and advocacy and highlighting cases that you see, engaging with us to pilot solutions, and working with us to design a system that reflects the realities that you're facing every day. This is where curiosity and a growth mindset really matter. Just because this is how things are today does not mean that is how they should stay. And while it's always easier to do nothing, we know that's not good enough. Australia is watching our industry. We need to put pressure on for real change that isn't driven by only a few or the most influential or by protectionist views, but is shaped by the needs of those who are hit hardest under the current system. Together, we can build a modern framework that ensures pets receive timely care, gives carers access to support options that fit their circumstances, and sustains the well-being of the veterinary profession. Because at the end of the day, every animal deserves access to care, every carer deserves peace of mind, and every vet deserves a profession that is sustainable. And as an industry, we must demand that veterinary care in Australia be accessible for all. This is a real challenge that we can solve if we work together with open minds for the animals, the carers, and the veterinary profession. Thank you.